This is Eileen Fee of Transform Your Body Fitness. I'm a physical therapist, a fitness coach, and a patient. Yep, you heard me right, a patient. It started when I was 10 years old. I was in the backyard playing football with all my friends and ended up breaking my leg. But when I was being rushed to the hospital, I thought, oh man, this is going to be cool. I'm going to get some crutches and, be really kind of cool. That's not what happened. I woke up and I found myself like this. There was a pin that was surgically put through my leg. It was out on each side. It's not because it was doing anything to heal the bone the way you hear people with pins inside their leg. This was put across my leg so that it could hold this metal horseshoe, so that was attached to weights that were at the bottom of the bed. And the weights would pull you down. You would use the trapeze to pull you back up. I did this for 6 weeks in a hospital bed. They don't do this anymore because it doesn't work. This was crazy. But the point is, I was a kid. I was scared. This was not something an active kid really, could comprehend at all. But I was told, okay, after 6 weeks, you're going in a cast. So I thought, okay, here come the crutches so I can be cool. All right. This is what happened. They put me in a body cast. So this is, again, I was in, at least I was home, but I was in bed for another 6 weeks. Again, this is the way they used to do things. They don't do this anymore. For a fractured femur, if you're wondering, what the heck did you break? But the point is that the mental stuff you go through, depression, being scared, being vulnerable, your life changes, from being active to being bedridden. It's not fun. This whole process of being in traction and the body cast went on. You figure that's a total of 3 months. And then physical therapy started, and I was excited. Okay, here come the crutches, right? So, yes, I did get the crutches, but the disappointing thing and the most upsetting thing was now I have to learn everything all over again. I had to learn to walk all over again. My leg was small from being in the cast and from laying in bed all that time. It was weak. It was painful to go through these exercises and to put weight on it. I really thought, oh my God, am I ever going to walk normally again? Because I had to walk with a limp. I couldn't walk as far. It really changed my lifestyle from this active, crazy kid to now this kid that was really having a tough time just walking. Now, the point is that impacted my life. While a lot of that was not fun to go through, it impacted my life to make a decision because my physical therapist was wonderful, motivating, inspiring, kept me going when I felt like quitting, when I felt like crying, when it was painful, took my mind off of the pain, gave me things to do, got me better, got me strong. And so again, it impacted my life. So obviously I became a physical therapist. 28 years later now, here I am. And hope that obviously my patients can say that I've inspired them and gotten them better. And it really is an incredible profession. It makes your heart grow. And I wouldn't trade a single second for everything that led me to this point because it really has been an incredible profession to be in. But now I'm still a patient because I'm now 53 years old. I'm actually going to be 54 in a few weeks. The point is that just like everybody else at that age, starting with back pain, starting with knee pain, back a few years ago, I had gained a lot of weight and I was in the worst shape of my life. So I had to go through a fitness journey to lose weight, to get stronger, and to regain my life back so that I can be a good role model to my patients. And what I began to realize, there's a huge gap between physical therapy and home fitness. Regardless of your injury or if you had surgery, or it doesn't matter what the situation is, if you're in pain, while we can do a great job with you in physical therapy and we can send you home with a good home exercise program, it's limited. You need something that's going to keep you going the rest of your life. So I hope you're going to follow me because what I'm in the midst of creating is a series called Bridging the Gap between Physical Therapy and Home Fitness. These are the things that I've learned that not only as a patient, when I was younger, bringing forth that motivation and understanding what you go through as a patient, and understanding what it's like to be in pain as you get older, and how you still need to have something to understand, not only from the medical point of view, but home remedies and exercises to make things easier, to deal with your pain, to give you tips and tricks from the professional. So this is going to be a great series. It's going to be a lot of fun. I hope you join me on my series because I know that it's going to help. My philosophy is it's about staying as healthy as you can for as long as you can. Tune in for Bridging the Gap between physical therapy and home fitness. See you then.